This report is devoted to the comparison of Skinner devices with other methods and techniques of electrotherapy. Well, Skinner device carries information in its name about what it is and what it uses for its effect. Self-controlled energy neuroadaptive regulator. More precisely, it could be read as a self-controlled energy adaptive neuroadaptive regulator. We will talk about this in more details later. In scientific literature, the Skinner device is most often mentioned not as a Skinner device, but synonymously as biocontrolled electrical stimulation or electrotherapy, biofeedback controlled, bioregulatory, sometimes neuroadaptive or electroneurotherapy. There's a huge number of synonyms because most authors remember that Skinner is not only an abbreviation of the method, but also a trademark. And in scientific research, it is often not permissible to use a specific commercial model name. The generic name needs to be mentioned. The Skinner device itself is a biocontrolled electrical stimulation or electrotherapy operating through a biotechnical feedback. It differs significantly from all other methods of electrical stimulation because it is essentially a stimulation using several therapeutic factors, such as an electric field and electric current. Moreover, often simultaneously. Furthermore, the Skinner device is essentially several devices in one casing. By changing the electrode and the type of contact, for example, dry electrode to skin contact, contact with hydrated skin, or the use of zero-resistance liquid phase electrodes, we essentially change the electrical stimulation. One Skinner device can often replace an entire physiotherapeutic procedure room. Now, let's compare it with conventional electrotherapy, such as transcutaneous electrical nerve stimulation, or TENS, microcurrent therapy, the well-known Bernard currents, or diadynamic currents, interferential therapy, neuromuscular electrical stimulation, ampli-pulse therapy, also known as sinusoidal modulated current, and high-voltage pulsed current, or HVPC. We can compare well-known physical characteristics such as waveform, frequency ranges, output voltage, output current strength, signal variability under load, meaning contact with the human skin, the presence of feedback allowing modification of the signal, and types of electrodes we use. Let's look at this summary table, where we can see that essentially only high-voltage pulsed currents resemble the Skinner device. As you can see, in most cases, either the stimulation voltage is very low or the current strength is very low. The frequency characteristics of the signal itself, and I mean both the frequency within the signal and the repetition rate, they all vary. Only high-voltage pulsed currents are somewhat similar to the Skinner device because they have the same high voltage and typically they also use metal electrodes, just like we do in Skinner therapy. Let's analyze the characteristics of the Skinner device in detail. The waveform of the Skinner device is a complex, bipolar, biphasic signal that can change from periodic to sinusoidal through the very same biotechnical feedback. Stimulus repetition rate ranges from 0.6 to 500 Hz, which may differ in various models. Frequency within the stimulus ranges from 50 kHz to 500 Hz, averaging around 20 kHz. Output voltage ranges from 1 to 350 volts using a coaxial electrode. Output current ranges from 1 to 140 milliamperes, but already on conductive gloves or self-adhesive electrodes. The signal is extremely highly variable. due to that very multi-parameter feedback based on complex electrodermal impedance. The electrodes of the Skinner device can be completely different. Typical electrodes for Skinner are metal electrodes, but we also can use conventional electrodes such as self-adhesive electrodes, conductive gloves, etc. The waveform of the Skinner device changes over time. That is, if we place an electrode on the skin, after 30 seconds we can see significant dynamics. The internal frequency of the signal is significantly decreased, the voltage amplitude is significantly reduced, and the pulse duration is increased by more than 4 times. In this slide, we can see an animation showing sequential changes on skin areas with different characteristics, on the palmar surface and on the dorsal side of the hand. On the back of the hand, the skin is thin, quite dry, and has high resistance and low capacitance. On the palmar side, the skin is moister, the cells are larger, and the electrical capacitance of the palmar skin is much higher. And we can see different patterns of the signal. So which electrotherapy methods can we compare? Well, first of all, TENS therapy. Because in most cases, the Skinner device physically resembles TENS. It is similarly small, also gives a tingling sensation, it bites the skin, and importantly, pain relief is also its main task. But in essence, TENS, despite having somewhat similar in frequency characteristics, is not Skinner at all. Look at this slide. We can see a completely square or half-square pulse, which does not resemble the complex pulse of the Skinner device at all. Moreover, the signal is not changed at all. Now, what is microcurrent therapy? The microcurrent therapy involves the application of pulsed currents similar to those in TENS devices, but with much lower current strength, up to 1 milliampere. In contrast, Skinner devices typically deliver significantly higher current levels in most cases. The waveform you could see on the TENS slide I showed earlier shows the same half-square or square pulse. Diadynamic therapy, or Bernard currents, one of the oldest methods of contact electrotherapy. A half-wave rectified sinusoidal electric current. This is a method of stimulation extremely distant from the Skinner device. Moreover, it is a unipolar stimulation. That is, Bernard currents always have a positive and a negative electrode. The Skinner device does not, because its current is bipolar. If we compare it with interferential current, the interferential current essentially involves a pair of sinusoidal currents slightly differing in frequency. And in places where these sinusoidal waves intersect, where the frequency differs slightly, a beat frequency occurs, and a so-called internal current arises. Our Skinner device is significantly different from interferential therapy, because in essence, interferential therapy was born as an extension of sinusoidal modulated currents. Neuromuscular electrical stimulation is intended mainly for stimulation of motor nerve fibers, and essentially it is a variety of TENS, but specialized exclusively for muscle stimulation. Russian stimulation, as it is called in the Western countries, or sinusoidal modulated currents, or mid-frequency therapy, also known as ampli-pulse, is a sinusoidal modulated current controlled via amplitude modulation. And also, there is a common carrier frequency that in principle does not change as in interferential therapy. This is not Skinner. Meanwhile, the high voltage pulsed current, or HVPC method, is somewhat similar to Skinner therapy, because its basis consists of spikes, high voltage signals resembling needle-like pulses. Often these spikes are grouped into batches. In the Skinner device, such batches are referred to as intensity. However, there is a difference. HVPC predominantly uses a uniphasic current, meaning it is monopolar. Nonetheless, the current strength and voltage characteristics correspond to those in Skinner. There are other electrotherapy methods that are not obviously close, but are in fact related to the Skinner device. Surprisingly, the very first among them is the Darson valve therapy method, known for its distinctive glass electrode glowing with a mysterious red light. Imagine that! However, Darson valve therapy is much closer to the Skinner device in its characteristics than, for example, TENS. Another electrotherapy method that surprisingly does not initially resemble the Skinner device, but is actually closely related to it, is the Hive-Amat method, or deep oscillation. This method involves massage with an electric field, which the authors refer to as electrostatic massage. However, this term is somewhat inaccurate, because it is, in fact, a massage using an electric field. The electrode in this method can be either the operator's hand wearing a dielectric glove or a metal electrode covered with a dielectric material. In this procedure, one electrode is attached to the operator and the other electrode is held in the patient's hand, with vibration occurring at the point of contact. Interestingly, the Skinner device can also operate in this mode, and its characteristics are very close to those of Hive-Amat. This similarity was noted by Yakov Greenberg in one of his articles, where he emphasized vibration as a key influencing factor. And another method of electrotherapy, very rare, but nevertheless mainly used for transdermal transport. This is the method of tissue electroporation. The fact is that in this method, an electric field causes cells and cellular structures in a volume to vibrate. As a result of these vibrations, if we take a look at micro level, there are clusters appearing on the membrane, on which artificial pores appear, or initially the natural pores may open first, which are ion and protein channels. The Skinner device can also operate in electroporation mode. Oddly enough, the Skinner device is extremely close to electroporators in its characteristics, and in vitro and in vivo experiments, it is capable of this very phenomenon, which is introducing high molecular weight colored compounds under the skin. Electroporation is also used for needle-free mesotherapy, sometimes for needle-free vaccination. This method is good because we do not violate the integrity of the skin. It is a non-invasive method. We simply place such an electrode, which also resembles a Skinner device electrode, and high molecular compounds, including, for example, vaccines. Sometimes we introduce well-killed or gloriously tormented microorganisms under the skin. Thus, we do not violate the integrity of the skin. We give the body the opportunity to develop its immune forces. So, Skinner stands out by being comprehensive compared to other electrotherapy methods, effectively replacing many of them. This is clearly seen when examining its physical characteristics. While most electrotherapy devices operate within a narrow range, only scanner functions over an extremely wide range. The image from the scanner patent illustrates direct control of the therapy energy and the implementation of biotechnical feedback. Essentially, the human body represented on the right side of the electrical circuit becomes part of the device's circuit, shown on the left. This creates a resonance circuit, with biological tissue being a component of it. The scanner impulse is completely non-damaging. Its energy characteristics are insufficient to cause significant or even minor damage to human body cells. We have conducted special studies, including on animals, to confirm this. It is highly variable, with variability that covers all dimensions for stimulating different types of nerve fibers. This diagram shows that all electrotherapy methods operate in narrow ranges, while Skinner covers the widest range. So, the Skinner device is extremely interesting because it produces a physiologically dynamic signal that resembles the nerve impulse of the autonomic nervous system. It is an adaptive therapy. The signal changes over time to be most applicable to specific physiological conditions. The device operates over the widest range of frequencies, voltages, and currents, and it is capable of generating high voltages. Skinner also induces a tissue vibration effect. Additionally, Skinner has an automated dosing mode, allowing precise control of treatment duration, which sets it apart from the most other electrotherapy methods, where dosing is primarily time-based. The device can measure and quantify physical parameters seen on the oscilloscope and display them digitally on its screen. By evaluating these feedback visualization parameters, treatment can be optimized by identifying skin areas with significantly different characteristics, thus enhancing treatment quality and precision. Skinner is a unique adaptive electrotherapy that operates over an extremely wide range of frequencies and voltages, and, most importantly, possesses a complex feedback mechanism. The Skinner device can effectively replace a full physiotherapeutic room, being compact in size while supported by a substantial clinical base of more than 2,000 publications, demonstrating its effectiveness and safety. Thank you for your attention.
Спасибо за внимание.